Season 4 of Be Inspired is dedicated to the memory of Rob Isbicki, a guest of Season 2. His family remains in our thoughts and prayers.
I will say that, at least when I personally went into the ICU and saw these patients, I had the appropriate gear. I did, at least. So I can't speak for others in that regards, but, you're still wondering how much more do I need and where is this going?
Be Inspired podcast. Real stories from real people. Sharing stories of love and loss, struggles and perseverance, laughter and tears, and overcoming adversity.
On this very special episode of Be Inspired, we're going to be taking you to the front lines on the war on COVID-19 and hear the stories as told by a doctor, a frontline professional. He's going to be sharing his personal experiences and details an unfortunate, unspeakable loss. Hi, I'm Bert Barron.
And I'm Lisa Anderson.
And we welcome you to a very special Be Inspired. Lisa, the frontline medical professionals in this war on COVID-19 and coronavirus truly define what it is to be a hero, to put their own lives on hold, to make sacrifice for others. And we're going to be learning a lot about what it's like to be in that moment as hospitals are inundated and supplies and nerves are sort of pushed to the very edge. And we're going to be learning a lot in this very special episode of Be Inspired.
Yeah, and I often think about the fact that I have a hard time wearing a mask for a short period of time. And these brave men and women have to wear the PPE all day, sometimes 12-hour shifts. And that was always something I was thinking about. And I'm so glad that they were recognized in a lot of ways here along the Jersey Shore and in all the hospitals, because they deserve every bit of credit that we give them.
Our guest today is Dr. Jeff Miskoff, who is here to share his experiences of what it was like, and he'll take us kind of into that moment there during the height of the pandemic. And Doctor, welcome to Be Inspired. It's great to have you here.
Thanks, Bert. Thanks, Lisa.
Take us back to the first patient and the first time you encountered coronavirus and COVID-19.
Right. So I was in the intensive care unit, from the first week of COVID. It was early March. And the first patient I took care of was a physician. And I can't tell the, specific details about that exact man, but, in general, he was a doc younger than me, and he had caught COVID, probably in practice, and he got very, very sick and almost ended up on a respirator. And this, you got to remember, was in the very beginning when we had really no idea what we were doing as far as treatments go, and just kind of trying to figure it out day by day. And he came very close to a respirator and somehow pulled out of it. He's, again, a young man. He's the guy who's supposed to make it. He's in great shape, and he did get out of there, nearly escaping the respirator. It really opened my eyes, because as the first patient, and it being a doc, it said to me, at least, I'm at risk, and this guy's younger than me, so it put the angst right from the beginning in what we were doing.
Are you normally in the ICU?
So, I've been with this group, Pulmonary, for 16 years. I trained in New York City. I came back to New Jersey. I'm from New Jersey originally. And when I started, I was an ICU doctor almost, exclusively. So I did that day in and day out for 5-6 years, and then started to make the transition to the office. So when COVID hit, I was probably 70% office-based and about 30% hospital, ICU, et cetera. But when COVID hit, our group made a decision in line with the hospitals that needed the docs to close our offices down, all 3 of our offices, and triage all 9 of our doctors, partners, to the hospitals, 2 hospitals that we go to, Jersey Shore and Ocean Medical Center, part of the Hackensack Meridian system, to help out. And they were very thankful for that. We left one of the senior partners basically doing some phone calls just to keep the doors open, the lights on, as far as, there's communication with the outpatient setting. But yes, I was brought back to the ICU and the floors at the hospitals full-time for 3.5 to 4 months on a 4-day on, 1-day off schedule, nonstop, until really a couple weeks ago, where we kind of went back to the original schedule almost, as the numbers, thank goodness, have dropped significantly.
Doctor, we've seen the pictures on the news of ambulances lined up outside of hospitals bringing patients to the hospital. We heard the stories of equipment shortages and PPE and just not having enough of what you need to fight with this battle with this virus. As a doctor, when the cases started coming in, did something in your head kind of go off and say, man, this could be really, really bad?
Yeah, and it became very bad very quickly, where the numbers rose. By the second, third week of this, we were looking at 20 respirators with COVID, then 40, then 60, exponentially going up. I think to the point where we hit almost 80 or so at Jersey Shore, and pretty much all COVID. Right, kind of unusual. We're used to seeing a whole plethora of different illness and ailments, and all of a sudden, almost every single admission was COVID, like 99% it seemed. And then we'd get an occasional, and I think that the patients were just cautious. The general population was trying to stay out of emergency rooms. They were scared. And it was, and some of those patients may have suffered at home with other ailments, scared to come in. And really, it did seem like every single patient we cared for had a diagnosis of COVID.
I know, Dr. Miskoff, that you had a very personal tragedy, and I can't imagine. First of all, our condolences on the loss of your mom.
My mom passed of COVID-19. She caught it at her residence. It's a nursing home facility locally, and so did her significant other. So he came in as well just a few days later. And curiously, no matter what I did with Mom, she got better initially with the COVID, the alleged COVID treatments that we have, but then unfortunately got a secondary infection with staph and MRSA, and that grew in her bloodstream, and then fungus. So it was a combination of sort of a snowball effect after the COVID, and we were not able to save her. And I had a lot of team members and partners that were helping, thank goodness, because you get so emotionally drawn. I had lost my dad a decade ago. I wasn't his doctor, but I know the emotional connection, and when you start to get involved in the care, it takes a big toll mentally and physically, and especially with this. It was the hardest thing I ever did as a physician. In caring for a patient, for sure.
I'm sure, and our condolences, Doctor, obviously,
Thank you.
and thank you for being here to share the story. But for every COVID patient that you encounter, is it an opportunity to learn? Do we learn a little bit more about how this virus works with every positive case?
Yeah, I mean, it seems that way, and you would be inspired by one patient doing well, and then two patients doing well, and then all of a sudden, why is this 30-something-year-old in that isn't doing well and maybe ended up not making it, or on a respirator, or with a tracheostomy, chronic problems, which we're now just uncovering as we move forward and see the follow-ups several months later. But yeah, I mean, there were definitely things that seemed to work and not work. Of course, when you look at the general recommendations, you need those large randomized controlled trials before we really know, and that's certainly one side of it. And the opposing side to that is, look, we're at war with an unknown enemy, and you do what you got to do to try and save the patient, and that may be, a sort of off-label. Of course, everything was off-label initially, right? There is no labels except for the early hydroxychloroquine, as we heard, and then remdesivir came out. So plasma, of course, became big, and we built on our armamentarium of what we treat patients with. But then when you look at my mom, who received remdesivir and plasma and seemed to do well, and her significant other who came in, who also got just 5 days of remdesivir off the bat, he walked out of there. Unfortunately, 3-4 weeks later, he failed to thrive and did end up on hospice, testing negative for COVID just on the day or so that he was placed on hospice. So there's no rhyme or reason to it, and we're still trying to figure out that formula and code as to what puts one person at risk and respond to one therapy, and yet somebody else randomly doesn't seem to respond. And I think the answer will probably be found that you have to treat these patients early. And I felt sort of discouraged and at loss of getting them more severe in the intensive cares and on the floors at the hospital, when really you start to wonder, is it something more simple that you could get to these patients in the primary care level earlier on or preventatively that may have stopped the process? And hopefully we'll figure that out by next year.
It's so bizarre, Dr. Miskoff, how each case seems to be completely different from the next. Some are asymptomatic, some have just a slight fever and a sore throat, achy, like a bad, cold, and then that goes away. And then there's others who, like you said, the physician, and I mean, these young people are passing away, they're down for the count. I read somewhere where they found a connection, and correct me if I'm wrong, between blood type and COVID symptoms. Have they put any research into that?
So, a lot of that will be retrospective analysis when they go back and look at the cases and see, how did patients do that they already have data on, as opposed to a prospective study where, those are going on as well. I don't know, and specifically with those blood types. My mom had the best blood type you could have, O positive.
O positive, right.
And she passed. So, again, she may have done fairly well with the COVID, but yet caught a secondary infection, and that may not. So it's hard to splice out those details and data to really say for sure. We don't know right now if that's a true statement, but yes, that was earlier data that came out of China that seemed to, at least initially in those early reports, look like there may be a benefit to being certain blood types. But to be quite honest, I'm not sure.
Okay.
You mentioned that you've seen so many different people, various age groups, all contract this virus and COVID-19. Should everyone be tested, doctor, whether you're symptomatic or not?
Well, that's a great question. You know, it was thrown out in the beginning. Should we just test everybody, get it over with? The problem is production, and there's, you know, public and private sectors, and there's a whole argument there as to, you know, why hasn't the private sector jumped in more, and some of them have. I just don't think there's enough tests available to test everybody. I mean, it'd be great if you could set every house 5 or 10 kits. You could swab or do a sputum test and send it in, and everybody would know immediately. But I think the logistics of that are quite difficult, and maybe we'll pick up the speed and be able to do that by next season. But I just don't think it's possible. Of course, you know, I've been tested 5 times in different forms and been negative, thank goodness, each time. And when I was spending hours with mom in the room with the N95, the surgical mask, the face shield, and still, it's my mom, but you're still wondering, geez, you know, I'm right there. I was helping moving her. I was trying to position her, really getting hands-on, you know, sleeves up. And, you know, of course, I went and got tested, you know, the next day. And I did that frequently. But for the general public, I just don't see it possible right now to be able to do mass testing with what at least I've experienced. You know, we're still guessing to some extent. Somebody calls the office and they have symptoms. We're like, okay, I guess you go to this urgent care or there. It's not just like you pick up the phone and a van pulls up and can test you. It's not at that level yet.
I know at one point it seemed as though the hospitals were completely overwhelmed. Describe a typical day, not typical, but what it was like for you and your staff in the ICU day after day. What was that like for you guys?
Yeah, I mean, again, you're always thinking, can I catch this? I was inspired mostly by the nurses and respiratory therapists that were really spending, I would say, cumulatively a lot more hours in those rooms than the physicians. I mean, a lot of it, once they got sick, they ended up on respirators, on multiple sedatives. We put them in what we call prone beds, where we kind of flip them upside down to get the oxygenation better. And they're sort of on cruise control for a while, day in and day out, as you try and, you know, tweak the sedation and the oxygenation. You know, we talked about how there's such a difference in these cases that presented, but yet the ones that got severe had a lot of similarities. And, you know, they had this sort of typical pneumonia bilaterally where it sort of hung out at the edges of the lungs, and we didn't know if it was blood clots or lipids, and we're given blood thinning products or, you know, heparin products, this type of thing, and it seemed to help a little bit, you know, but there were similarities at that level in the most severe cases, but a day was a lot of nervousness, angst about not being able to save these patients first, and then you're also thinking about yourself and your colleagues and bringing it home to your families, and you know, you should have seen my garage at one point. I had belts lined up, shoes lined up, I've got boxes of recycled masks, I've got different kinds of masks that you're collecting from wherever you can get them, and you know, I will say that, you know, at least when I personally went into the ICU and saw these patients, I had the appropriate gear, I did at least, so I can't speak for others in that regards, but you know, you're still wondering how much more do I need and where is this going? Even though the CDC and these organizations are putting out recommendations, when you don't know a lot about a condition, you wonder if those recommendations are in fact enough, and you can't be too careful type of approach. Sure. But the sadness of losing these patients and these patients these people not having their family members with them is the one thing I can say with my mom, at least, even though when she got really severe and sick and was, you know, on multiple sedatives, at least I was still there and present, and I was able to walk her at least to the respirator, as sad as it sounds. It was very difficult. So for me, you know, it was the general population of patients that was very tough to take care of. Of course, inspired by, you know, the ones that did well, that first doctor, oh, look, we could save this guy. Maybe we can save the 85-year-old. Maybe we can save the other 30-year-old who may just be in community with no medical risk. And then sometimes you failed.
When we come back on Be Inspired with Dr. Jeff Miskoff, we'll talk about the possibility of a second wave of COVID-19 here in New Jersey, and what is the medical community doing to be prepared in the event of that second wave. We'll talk about that and more coming up.
Moving is difficult. At Loews, it doesn't have to be. For all of your residential and commercial moving needs, contact 732-775-4118 or get a free FaceTime estimate. Loews, proudly serving New Jersey for over 96 years. IgA Nephropathy Foundation of America is a patient-centric organization dedicated to finding a cure and better treatment options for IgA kidney disease. If you or someone you know was recently diagnosed or to donate, please visit IGAN.org. In this new day and age of online meetings and presentations, you need the best team at the ready. Whether broadcasting your Zoom meetings to Facebook Live or live streaming a fundraiser event, Surreal Streaming Services, with over 10 years of experience, can add confidence to your next live stream event. Call or text 646-498-8888 or visit sur-real.com. Feeling stuck with your health goals? Michelle Weber Integrated Fitness and Lifestyle Design specializes in integrating simple daily routines to get you moving towards strengthening your core and boosting immunity and resiliency. With over 15 years experience, let Michelle's team help you reach your fitness and lifestyle goals by visiting michelleweber.com or on Facebook at Michelle Weber Lifestyle.
We're pleased to have Dr. Jeff Miskoff with us on this edition of Be Inspired, and we're walking back through the height of the coronavirus outbreak and also taking a look at what the future months and years will hold. Doctor, at the time of this recording, we're hearing about numbers and record cases of positive tests in other regions across the country. It begs the question, is New Jersey ready in the event of another surge of this virus? And what do we need to do to be prepared? My biggest concern is, of course, materials, masks, gowns. I'm worried about human capital as well. You and your fellow medical professionals, your people too, you have a breaking point also. How do we prepare in the event of a second wave here in New Jersey?
I mean, again, I think the good part of it is at least we've had one round of experience. So we're more experienced as a society, as clinicians, in regards to that. When we got hit with this, remember the first case was reported in Washington State in early January, and they're telling us the first cases were here in New Jersey, New York in kind of March. I wonder if that's even true. How could it have been in Washington State in January and not one person in New York City or New Jersey have it? Well, the antibodies were mostly negative in these patients, although now we're starting to see cases where they were antibody positive and 3 or 4 months later antibody negative. So do they just kind of run lower on the quantification of that? But I do think we are more prepared for round two. I think there will be cases that go throughout the summer. I've kind of told my family they want to, my son's going to go back to school like our others. Kids have to go back to school and colleges and stuff like this in the fall. I would feel comfortable sending my son back to school if, in fact, there were basically zero admissions coming into the local hospitals. My son goes to school in Monmouth County. I work in Monmouth and Ocean County. If I'm seeing cases come in, still 20 admissions, 30 admissions, I just don't see how it's safe, right? But if it goes down to zero admissions, like it has in other countries, at least for periods, then I think the relative risk, at least, is reasonable. You take a risk in everyday life, right? When you get in a car, you take a risk. You cross the street, you take a risk. So what level of risk am I willing to put myself and my family at? And I think, I feel more confident once those admission rates, and I'll know what they are. We'll know what they are. It is public data, and Hackensack Meridian is transparent with that. They do keep us updated a couple times a week. So I'll know when those admissions are at a very, very low amount. Will the human population have more herd immunity? Will there be a modified, lesser strain of the virus? These are all questions we don't know the answer to. But I still will feel very nervous as long as cases are coming in, and that's my answer to my patients and other people that ask me that same question. As far as protection goes, I hope, again, with the one round of experience, that the hospital systems that were less prepared are more prepared. I'm not going to point fingers at which ones were and weren't. I know that a lot were caught off guard, especially in high populous areas of the tri-state area here, and now we're seeing an aftermath in these other states, as you mentioned, Bert. So why did it take so long to get to these other states? Why didn't they get it in the same numbers up front. Is it just that dense population that led to the rapid spread? But I do think we are in better shape next round. I do trust science, and I do feel like the pharmaceuticals will be figured out better. I do have some concerns about big pharma and these more severe treatments getting a lot of attention, where some things that may be more anecdotal and lesser treatments or less expensive treatments maybe not getting so much attention, when we could do some more things maybe preventative on that primary care side, which again is still an unanswered question. Can we figure out that combination? Will the numbers be in fact a lot lower because of the social distancing, the masks, and really my population, which is I would say over 60% Medicare in the outpatient, they've been good. I mean, they've been nervous and stayed in and did what they were supposed to do and wore their masks and did.
Right.
So again, we're at least one step ahead of the ball going into the next season, and I think that will definitely help and get down that sort of contagion factor to a lower risk.
You hear a lot of talk about we'll be okay when a vaccine comes out. Vaccine. I know it takes years of research for vaccines. What are your thoughts of them pushing it through so quickly? I don't know. I'd be a little. I have my reservations about that. I'm being honest.
And rightfully so, Lisa. I mean, we don't know if these are going to be so effective. There's a few companies getting a lot of financial support from the feds. I think it's good to support them and to work towards cures, if you will. But I wouldn't be surprised if we have a vaccine, it's just not very effective. And like you said, it takes years to develop an effective vaccine. I think there may be probabilities of combining a vaccine with some sort of antibody or monoclonal antibody or a higher level of treatment as well, where you put them together and get a better response. But I don't know. And safety, right? What is the safety of these vaccines when they're pushed through industry fast? Of course, they'll do safety trials and they'll prove that they were safe. But there's a lot of naysayers in that regards, and I'm not going to pick sides at this point. I think there needs to be work done on it. I think, obviously, if they have an effective, safe vaccine that's proven in these trials to really work, that would be very helpful. But I do have my reservations and my concerns about the quickness and rapidity of, rapidness of how they're getting pushed through, and what effectiveness and safety will truly have. That's my unknown, opinion on it right now.
Sure.
For a period of time, Doctor, elective surgeries were put on hold. Part of it was in the interest of preserving equipment for frontline people to make sure that they had the tools that they needed. It's safe to go back to a hospital now. Cleaning procedures, protocols that are in, social distancing, checking temperatures of people who arrive at a hospital. It's safe to go back to a hospital for a procedure now, right?
I would say for the most part, yes. Our offices are now back open, Shore Pulmonary, where we see private practice patients. So certainly, if watchers or listeners of the show have questions, they can certainly make an appointment. I am a COVIDologist now. I can't tell you that I am the leading expert in the world on preventative measures, but certainly we are available, to field those at least telemedicine visits, which is how outpatient has gone, because there's still a lot of patients that are concerned about coming in, and the federal government has allowed Medicare, et cetera, other insurance companies, private payers, reimbursement for doing a initial or even follow-up telemedicine or video visit, which is a little strange to some people, and it should be. It's a newer type of thing, at least more robust recently. And some people don't even have smartphones. I mean, they have flip phones still, and you can't even communicate with them except for a telephone call, which again the federal government has also allowed more recently. So,
Dr. Miskoff, through this whole ordeal, how has it changed you, not only as a physician, but as a person?
Yeah, I mean, it's a great question. I don't even know if I can answer it completely. There's a definite, form of PTSD, if you will. I'm not making an official diagnosis on myself, but certainly for the providers that were out there, and there are some people that handle these healthcare crises better than others. I was involved in 9/11. I trained in New York City, and we were prepared to handle massive casualties. I certainly didn't see barely any patients that came in from that, and that was a different situation where it was more fast, furious, and then it was sort of over, right? It wasn't a pandemic, but also involved in HIV treatments at that time, and that was scary in its own right. But that you had to catch from somebody in a different form. You couldn't just breathe in air particles, right, and respiratory droplets, if you will. So I mean, there's just so much to that, but. I don't know. I think we just have to stay alert, awake, oriented, and do our best to protect each other and get through it.
Are you concerned about a potential of people working in the medical field as a result of this pandemic, that they might be scared away? And this is your chance to inspire them that to pursue this, that helping people at this level is still, it's the best way to help people.
You know, there's been some talk about those who are near retirement that were not maybe ready to retire may jump out of the industry because they're concerned about catching it. I do think, just going back to the last part, that it is safer than it's been. It's at the safest level. But you remember, the most common symptom in this condition is no symptom, right? Asymptomatic. So even though we're checking temperatures in the office and at the hospitals, somebody could still be an asymptomatic carrier. So that's why the precautions have now escalated to most recently, where if you're inside the hospital, you have to wear a mask unless you're sitting alone, unless you're 6 feet away, continuously, and now even they're advising a face shield for the providers inside the hospital as the numbers are at the lowest amount that they've been. So kind of upping the precautions as the numbers go down may help. But if I needed a procedure right now or my family, I would say, given the current precautions, it is safe. There's always a calculated risk, as we said, but that risk, I believe, is at a low enough level where it justifies, going for the treatment.
We'll continue our conversation with Dr. Jeff Miskoff coming up on the next edition of Be Inspired. I'm Bert Barron.
And I'm Lisa Anderson.
And thank you for joining us on Be Inspired.
Next on Be Inspired.
When I show up at work, it doesn't matter what the diagnosis is per se. I see a person on a respirator with pneumonia. I'm going to do what I know in my training to try and fix them. Over time, with the treatments getting figured out, we'll still have less severe people coming in and we'll be able to treat them better. We don't want to have such blinders on that we're just looking for COVID and we're missing the obvious on other conditions that are right in front of us. You don't want to be scared of a virus that is at lower levels right now and then die of another condition that could have easily been prevented.
Be Inspired with your hosts Bert Barron and Lisa Anderson Puleo. Directed by Rod Weber. Created and produced by Michael R. Doyle. Co-producers Bert Barron, Lisa Anderson Puleo, and Erwin Sternberg. Executive producers Rod Weber and Sean M. Sternberg. Editor Rebecca Gruber. Social media team Rebecca Gruber, John Franklin, and Luke Lograno. Filmed at New Beginnings Foundation, Wall Township, New Jersey. And thanks to our sponsors, Loews Moving Service, IgA Nephropathy Foundation of America, Michelle Weber Wellness, and Surreal Stream Services. Season 4 of Be Inspired is dedicated to the memory of Rob Isbicki, a guest of Season 2, who lost his life to cancer, and to his service to the community as a firefighter. Rob was a proud husband and loving father who cared deeply for his family and friends. Our prayers are with Rob's family during this time.